Hello, today you are listening to Devery G,
And Tommy G.
and today we are going to talk to you about
L-Dopa.
L-Dopa. So Tommy, looking at this, I know this kind of gives you some anxiety, taking you back to OChem, but what this is basically doing is telling you the classification of L-Dopa. The main thing that we are concerned about is the subclass, which is amino acids, which is eventually going to turn into tyrosine.
Oh, that makes me feel a little bit better.
So what exactly is Parkinson's disease?
Well, Devery, Parkinson's disease is a movement disorder, and it's characterized by a resting tremor, bradykinesia, and rigidity and postural instability. It's caused by a degeneration in the loss of dopaminergic neurons in the substantia nigra in the brain.
Wow, try saying that 3 times fast.
But you can see on the pictures on the right here, on the one on the top, there's a little more dark. That's that's the deterioration or the degeneration that's happening in Parkinson's. So as I said, Parkinson's disease is a degeneration, but it's a slow, progressive degeneration of certain dopamine-secreting neurons in the central and the peripheral nervous system, and it actually inhibits the thalamus's ability to excite the cortex.
Wow, and it's estimated that more than 1% of the US population older than 65 years old is afflicted with Parkinson's disease.
It's a crazy disorder disease, but one good thing is that we can use L-Dopa and it can improve motor function and general mobility.
That's great. So treatments for Parkinson's disease include taking pills, deep brain stimulation, and supportive therapy such as physical therapy, the best kind of therapy, am I right? Speech therapy, and then dietary measures.
Although there's no cure, one nice thing is L-Dopa is one of the most effective drugs for the treatment of the symptoms of Parkinson's disease because it has short-term side effects, and patients actually have a better adherence to this medication as opposed to other treatments for Parkinson's.
The main drug on the market for Parkinson's disease is, Tommy, can you help me out with this one?
It's called levodopa.
Right, but we'll just call it L-Dopa for now. So what is L-Dopa? It's the precursor to the feel-good neurotransmitter of dopamine. It does not influence progression of the disease. Effects of L-Dopa are dose-dependent. Treatment with L-Dopa is recommended at all stages of the disease, and L-Dopa therapy has increased the life expectancy of patients with Parkinson's.
One thing that's really cool about levodopa or L-Dopa, it can actually increase the life expectancy of patients who have Parkinson's disease because they're able to avoid disease like related medical complications such as like pneumonia or fractures as the result of falls. So.
Way to go, L-Dopa.
So Devery, one really cool thing about L-Dopa, it's actually able to cross the blood-brain barrier. And so what the blood-brain barrier is, it's basically a mechanism that we have that keeps bad substances that are in the blood out of the brain. But this is exactly why we give a precursor to dopamine instead of dopamine to treat the symptoms of Parkinson's disease. So L-Dopa is converted to dopamine in the central nervous system and in the peripheral nervous system. It's actually commonly administered with another drug called carbidopa. It's a type of D-carboxylase inhibitor. And this decreases the amount of L-Dopa that is converted to dopamine in the periphery, which is then going to allow for more L-Dopa, to cross the blood-brain barrier.
That's really awesome.
It really is. But once in circulation, that L-Dopa is going to be converted into dopamine by the enzyme dopa decarboxylase. And that is actually found in the liver, intestinal mucosa, and the kidneys and skeletal muscles. So once it's converted to dopamine, L-Dopa actually activates postsynaptic dopaminergic receptors and compensates for the decrease in endogenous dopamine in the body. So it's kind of crazy, but only about 1% of L-Dopa reaches the brain.
Oh my gosh. So just for a little recap, since who doesn't like pictures? So let's first take a look at the picture on the left-hand side. The upper portion is going to be what's going on in someone that does not have Parkinson's disease. As you can see, there's a lot of little vesicles, those are those little dots, going from the end of the neuron into the postsynaptic cleft there. But at the bottom, we see somebody that's affected with Parkinson's disease, and they're not releasing as many of those little dots, which are dopamine, to the next receptor.
Oh, wow, that really clears things up for me.
Yeah. And so if we take a look at the one on the right-hand side here, this is how L-Dopa works within the neuron. So you're going to get the L-Dopa coming in from the top here. You can't really see my clicker, but the L-Dopa is going to come in. It's going to get transferred into dopamine within the nerve cell there, and then it's going to get released to the receptor site there. Administration. L-Dopa can be administered orally through a pill.
It can actually be administered through a Duodopa pump as well.
That is crazy. So the daily dose is determined according to each patient's needs. Dosages are progressively increased until a noticeable reduction in symptoms occurs or until side effects become a problem. So L-Dopa can be taken orally. There's 3 different ways that you can take it: the standard, dispersible, or the slow release. And that just kind of depends on how long it takes to get into your bloodstream. But typically it takes about 1 to 2 hours after taking your pill that the L-Dopa is in full effect in your blood. It's going to last for about 50 to 90 minutes, which is the half-life. So you're able to go for 2 times 50 to 90 minutes. What you're going to want to do, though, is you're going to want to take L-Dopa with food to reduce any GI irritation.
Oh,
but, sorry, Tommy, you can't take it with a high-fat or high-calorie meal. So sorry to all those keto followers out there. This is not for you. I also wanted to mention that L-Dopa is dose-dependent on the patient's needs. So this means that patients can range in how many pills they take. So it's usually 2 to 3 times per day. But, here's the big but, you do not want to exceed more than 800 milligrams a day.
Interesting. So L-Dopa, like we talked about, can actually be taken in through a pump called a Duodopa pump. And it's a type of infusion therapy. It's called intrajejunal infusion therapy. It's a treatment for Parkinson's in very advanced stages. So patients will be seeing a lot of motor fluctuations and possible dyskinesia. And it's for patients who can't control their Parkinson's symptoms with oral therapy. But the way it works is L-Dopa is bound to some type of matrix and is continuously delivered directly into the jejunum through a tube connected to an externally carried pump. And it gives you basically a constant level of L-Dopa in the plasma at all time for these patients. Unfortunately, the treatment is very expensive and it requires technical skills, like from a GI doctor, for the precise placing of the tube.
Dang, that does sound very technical. I wish we had a picture of that. Whoa, there is a picture. Cool. But what does all of this mean again, Tommy?
You'll probably just have to refer to the last slide for the information on this picture.
Cool.
However, in a study done by Carlsberg and Corbo, it's actually a paper that we got from the Ortel paper that we've taken a lot of information from. A total of 12 Parkinson's disease patients were assessed for the Duodopa pump therapy, and it was found that all 12 patients actually experienced significant reduction in fluctuations and dyskinesia as well, achieving a better gait function while on this pump therapy.
That's awesome. Now, like with any drug, there are going to be some adverse effects. So if we take a look here, we may experience some nausea, dizziness, headaches, drowsiness, insomnia. We can also end up with some confusion and hallucinations, but hey, that's PT school for you. You can also end up with some low serum vitamin B12. With the cardiac, we can feel dizziness, we can have some hypotension and arrhythmias, though those are very rare. Again, GI bleeding might come into play if you're not taking them with meals, and then also some hair loss.
That's my deepest fear.
Contraindications of L-Dopa include: do not use with MAOI inhibitors, could lead to hypertensive crisis. People with narrow angle glaucoma should use L-Dopa with caution because this can increase ocular pressure. Caution for patients with arterial nodal or ventricular arrhythmias. contraindicated in patients with pre-existing neuropathies.
So there's also some precautions with taking L-Dopa. There can be a heightened risk for GI bleeds, an increased risk for psychosis in patients who have already been diagnosed with a psychotic disorder. There's some possible toxicity. However, this is a fairly controversial topic. And one way to combat this would be a drug holiday.
I could take a drug holiday. Oh, drug holiday. Right. So what a drug holiday is the patient is gradually removed from all anti-Parkinson's medication for 3 days or up to 3 weeks. This period is to allow the body to recover from any toxicity or any tolerance that may have developed due to long-term use of L-Dopa. Drug holidays are used on a limited basis and only for a select few patients.
Oh, wow, that's interesting. So talking about some of the physical therapy implications with L-Dopa, drug therapy can increase the patient's ability to participate in physical rehabilitation. Anti-Parkinson's drugs help improve motor function, which is awesome for us. And that improved motor function can include cardiovascular conditioning, balance training, fine motor tasks, and various other rehab interventions that we do.
Gosh, this is making me so excited to become a PT. But I should mention, Tommy, there's a couple things that we need to take into consideration before we train with these patients that have L-Dopa. So having the patient take their dosage about an hour before therapy, it's going to help make sure that they are getting those peak effects of the drug therapy at this time.
Makes sense.
Yeah. And then also another thing that we need to mention, again, with the drug holidays, our goal as therapists is to keep the patient as mobile as possible. So that means doing some joint range of motion and some cardio fitness to help keep the patient, up to date with everything. So when they resume their activity, when their medications are reinstated. Some other things that we might want to do too with our rehab is some aggressive gait training, some balance activities, and then other exercises promoting optimal health.
So, Devery, something that we should really get excited about as therapists, or I guess soon to become physical therapists.
I'm already excited. What is it?
But there's now a belief that physical therapy, especially in patients who aren't seeing severe motor dysfunction yet, it can actually stimulate the regrowth of new pathways in this dopaminergic system.
And although we can't prevent the progression, our profession as PTs is one of the most beneficial treatments for Parkinson's disease.
That's awesome.
That is. There's so many new developments in treatment for Parkinson's, some of them being the BIG program and the Rock Steady boxing.
So just looking at this next slide, this is just an overview of one of the studies that we were looking into while we were doing our research, and it was probably the most beneficial to our learning. It had a lot of really good information about the different treatments of Parkinson's disease, so go ahead and read up for yourselves.
Thanks again for watching our video.
Shout out to you, Professor Hogan.
If you like it, give it a thumbs up. And heck, subscribe to our page.
And give us an A.